assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on our site. We do not endorse any recommendation or opinion made by any member physician, nor do we advocate for any treatment. You are responsible for your own medical decisions. Now I'm going to turn over the introductions of our speaker to Martha Butterfield, the Program Coordinator of NJCTS. Marty?
Thanks, Kelly, and good evening, everyone. Thank you for joining us. Before I begin the introduction of Dr. Joelle McGovern, I'd like to call your attention to the slide on the screen about our second annual Mendham Walk. If you have not registered for the walk, I hope you will after tonight's webinar. We would love to have you join us in Mendham on November 19th. If you're not from New Jersey or can't make it to Mendham that day, please visit our website and make a donation to show your support for NJCTS. It's events such as our second annual Mendham Walk that allow us to continue to provide interesting and informative webinars like the one tonight on how to interact with your child about anxiety. So I'm going to stop now before I begin to sound too much like public radio, but I will just urge you to take a moment after tonight's presentation and support the efforts of the New Jersey Center for Tourette Syndrome. It is now with great pleasure that I introduce Dr. Joelle McGovern, our presenter for the evening. Dr. McGovern received her undergraduate degree from Juniata College of Pennsylvania and her doctorate in clinical and developmental and school psychology from Bryn Mawr College, also in Pennsylvania. She is a clinical psychotherapist at the Child and Adolescent OCD, TIC, Trichotillomania, and Anxiety Group, also known as Cottage, in the Department of Psychiatry at the University of Pennsylvania School of Medicine. At UPenn, in addition to her work in the area of tics, trichotillomania, OCD, and anxiety, she also treats children with behavioral difficulties, post-traumatic stress disorder, and autism spectrum disorders. Previously, Dr. McGovern was at Children's Hospital in Philadelphia, where she worked with children coping with chronic illness, trauma, bereavement, and feeding issues. Her clinical and research interests include therapy for children and adults with anxiety, OCD, tic disorders, trichotillomania, as well as investigating the treatment effectiveness. So without further comment, I'm pleased to turn tonight's webinar over to Dr. McGovern.
Thank you, Marty. I want to welcome everybody and begin by thanking Kelly and Marty for all the hard work that they put into setting up this webinar, and the New Jersey Center for Tourette Syndrome for offering me the opportunity to share this information about how to talk to kids about anxiety. I'm very excited to be here and to speak with all of you on this very important topic. I gotta change my slide, sorry, to think about this. There it goes. So the agenda for the day, we're going to begin with some background about anxiety, thinking about the function of anxiety as well as maladaptive patterns of anxiety and how to change those patterns. Although this is background information, it's very important when you're discussing anxiety with a child, knowing how the anxiety works, how it switches from being helpful to unhelpful, and how to change those patterns provides the child with the knowledge they need that will then bolster their ability to change their patterns. We're going to take a closer look at the parts of the cycle, including thoughts, feelings, and behaviors, and finish by discussing how to motivate a child and support the child in facing their fears. So part of this background is normal developmental fears. There are normal fears that come up, they're transitory, they normally go away on their own, and they tend to come for everyone around the same ages. So in the first few years of life, often kids have fears of loud noises, strangers, new places, heights. Preschool age, it shifts a little bit into fears about being alone, fears of the dark, anything imaginary, fears of certain animals. And then at school age, when their interest in the world kind of broadens, their fears also broaden to include the world and fears of negative evaluation by others, illness, bodily injury, any kind of supernatural phenomena, natural disasters. So often you see these fears emerge at a certain time, and the kids move through them and they come out of them fine. the question people usually ask is, well, when do we do more? When do we know that it's beyond just this typical development? And there are a couple of things to consider. One is exactly that question. Does it fit the developmental pattern or not? So if I have a 13-year-old in my office that's still so afraid of the dark they have to sleep with their parent in the bed, then that's much more concerning for me than if I have a 4-year-old in my office where it tends to be more normal at that point. And so the question is, does it fit in the development where you think it should fit? And if it doesn't, that's an indication the child might need more help. Also looking at the frequency and the intensity of the anxiety. So is it happening once in a while, or is it happening all of the time, or a good deal of the time? And what's the intensity of the distress? Is the child a little distressed but then they move on, or are they completely falling apart? And even if the fears fall within the typical developmental range, if the intensity is such that it's creating extreme distress for them, then that's still a time where a parent might want to seek help for their child. The third piece is interference. So a kid's job is to have fun, play with their friends, be part of their family, and go to school. And is it interfering within any of these domains? This, real quickly, is just a list of the anxiety disorders. I'm not going to spend time on it because this in itself would take a long time to go through, and I want to get to how to talk to the kids more specifically. But these are some of the anxiety disorders that are treated: separation anxiety, social anxiety, selective mutism, generalized anxiety, simple phobias, panic disorder, obsessive compulsive disorder, post-traumatic stress disorder, and complicated grief. What all of these have in common, and what is most important for this evening, is that there's an intense, out of proportion, anxious response to whatever is going on in the setting, resulting in a lot of distress and often functional impairment, which is due to avoidance. So one of the important things to explain to kids is that anxiety has a function. Anxiety is not bad. Anxiety is actually a great emotion. It keeps you safe. It helps you focus on things that are important. This sort of helps get rid of some of the stigma around it, knowing that everybody feels it, and it actually has a good function. So if I'm a kid and I'm walking down the street and I'm anxious about getting hit by a car, that's probably good because I'm going to stay out of the street and it's going to keep me safe. But if I don't have enough anxiety, which I like to refer to as not having an alarm at all. So the real alarm helps you. Not having an alarm at all, probably I'm going to get hit by a car if I'm standing in the middle of the road and I don't really even care and I'm not anxious at all. If I have too much anxiety, which a good way to explain that to the kids is a false alarm, then maybe I don't go out of the house at all because I might get hit by a car. So I'm safe, maybe, who knows, no one can guarantee my safety even if I'm in the house, but now I have no life. And so looking at the function of anxiety, it helps kids realize when you have just enough, it's good. It can help you. It can help you do well academically. It can help you make friends because you're going to pay attention to what you need to pay attention to. But if you have too much, often it actually gets in the way of your goal. If you're too worried about your test and you can't concentrate and you can't study, you're going to fail or do less well. If you care too much about what people think about you and you're always worried about negative evaluation, inadvertently you're going to be breaking social norms because you're not going to be focused on the conversation or the people you're talking about. You're going to be focused on yourself and your thoughts and seem disconnected in the conversation. So that is a really good way to kind of describe to kids that anxiety is okay, it's not bad, but when it's turned up too much, if it's a false alarm, it actually can get in your way. And that's the piece that is important for kids to work on. So this slide is a little busy, but it is a nice picture of the way anxiety works. So usually, not often, not always, because sometimes it starts with an emotion, but usually it starts with the cognitive thought. So an automatic negative thought. This might be an anxious interpretation. It might be repetitive distressing thoughts. It might be a prediction of a feared outcome. So she doesn't like me could be an anxious interpretation. An OCD thought, an obsessive thought you can't get out of your head that's distressing, or a thought about a trauma that happened that keeps coming back and you can't stop it from coming back. All of those things make you nervous. And then when your brain sends a signal to your body that you're nervous, your body reacts. So now you're feeling anxious, maybe discomfort, maybe fear, disgust, depending on what it is. And often kids have physiological reactions. So their heart races, maybe they feel like they can't breathe. Some kids get stomach aches and headaches. So when you're having negative thoughts and these feelings that feel bad, the natural reaction is then to escape and avoid something that's feared or is making you anxious. And that escape provides you with temporary relief. The problem with that is that it negatively reinforces the escape because you get the relief, it feels better, so the next time you head into that situation again that made you anxious, you're going to want to bail out again because you remember feeling better. So that removal of the anxiety actually reinforces your avoidance, and your avoidance actually keeps the anxiety around. And in the long run, you don't learn anything. You don't learn that you could have handled that situation. You don't learn that your feared outcome may not have been true. Or if it was true, you could have handled what happened. So there's no learning going on, and the cycle just continues. So this is just a nice example of how it works. If I'm anxious about going to a social event, I avoid going, my anxiety comes down. So again, that avoidance temporarily relieves my anxiety. But the next time I get invited to a social event, my anxiety goes up again. I don't go again. My anxiety comes down. So this continues each time. So that in that short run, you're decreasing your anxiety, but in the long run, your anxiety stays high. So this is an important thing to talk to kids about, because what they're seeing is, well, hey, I didn't do it and I felt better. But what they're not seeing is, in the long run, I'm never going to be able to do that because I'm always going to stay anxious about it because I've always avoided it. So changing the anxious pattern, taking the last slide and adding on a more adaptive way to help kids deal with anxiety, is teaching them that they don't need to believe their thoughts. Thoughts may not be true. You can have a thought about anything, and just because you're having it doesn't make it true. So it might be a false alarm. And if it's a false alarm, can you think of alternate thoughts, other thoughts that make you feel better? And can you say, I don't need to listen to this. I know I see things negatively sometimes, and I'm probably something else better might happen than I think, so I'm not even going to listen to this thought. If you do that, then the emotions come down, you feel better. You might still feel anxious if this is your first time approaching and trying to do something that makes you anxious. And the message you want to get to the kids at this point is, it's okay to feel anxious. Feeling anxious is not bad. It's okay. And for these kids, it's good. It means they're doing the hard work. So when someone goes and works out in the gym and they feel sore, even though it feels bad, it feels good because they know they were working out. So it's sort of the same thing. When you know you're anxious when you're approaching something, you know you're working hard, and you're working to make your life better. The other thing is, physiologically, sometimes the symptoms of heart racing or having trouble breathing really scare kids. And just explaining to them, your body doesn't know anything. Your body is just following a directive from your brain. So if you have those symptoms, it's just because your brain has sent a false alarm to your body. But your body doesn't know it's a false alarm, so it's just doing what it does. So good, your body's working. And then let me figure out how to try to relax a little bit so I can kind of stay here and deal with what's going on. If you then use those thoughts, the alternative thoughts, and the acceptance of the feelings, that will help you approach and remain in the feared situation. And when you do that, what occurs is habituation, which really for kids is you just get used to it. And you can ask kids for examples. They can give you examples of things they used to be afraid of, but they did over and over and over. They got used to it, and they're not afraid anymore. That cycle then goes back and will positively influence cognitions in the future. Because now you've learned something. Now you've learned you went to that party and it wasn't so bad. You went to that party and somebody talked to you, and you made a friend out of the deal. And all your feared consequences about being alone in the corner and having kids laugh at you didn't come true. So the next time you get invited to a social event, well, now maybe it's more doable because you've had that learning. And then again, those cognitions will hit your emotions, and that will help you approach again, right? So if you're thinking better things, like I'm going to succeed, this is going to be fine, then you're going to feel better, and then you're going to be able to go ahead and approach again. So this is just a picture of how that works. So this, unlike the last slide that explained every time you avoid you get temporary relief, but then in the long run your anxiety stays. This is the opposite of that. So if you approach, you're going to be anxious, and you may even be more anxious than you had been in the past because you've been avoiding all this time. But it will come down because that's what your body does. That's why you have a parasympathetic and a sympathetic nervous system. So for the kids to know, if you stay in this situation, it will get better, it will feel better, it will come down. And each time, each of those lines going down lower, each time you approach the same thing, it gets easier. Your peak of anxiety gets lower, and you come down pretty quickly. And you start to get this feeling of mastery that, oh, I can manage this. I don't need to be pushed around by this awful feeling or this awful thought. Here's the simplified approach, which is blah, 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 do the thing you're afraid of, blah, blah, blah. The more you do it, the easier it gets. Good kids speak. I show this slide to the kids in my office because they get it, and because it was said by a 6-year-old. And so that's all it is. Doing the thing you're afraid of, continuing to do it, it gets easier. So again, not listening to that false alarm, doing it anyway, and habituating, getting used to it, and it's all okay. So when thinking about helping kids connect thoughts, feelings, and behaviors, identifying and challenging cognitions, and thinking about their behavioral response to anxiety, there are many methods to kind of help them with that. And so I know there are a number of different people on the line, including some medical professionals, some teachers, some parents. So I'm going to do this sort of broadly because you'll have to kind of put into your framework how it would work in your classroom or in the guidance office, or how it would work in your home or in your therapeutic office. But the point is to kind of match what will work for the children. So storytelling works fabulous for some little kids. Imaginary play. You can play out that cycle of anxiety with Winnie the Pooh characters very easily, and have an anxious character and go through the maladaptive cycle, and then do it the other way where they're approaching and they're managing, and they can learn how the cycle works through that play. Older kids you can just talk to. Many older kids you just have the dialogue with. Anytime you can let them sort of be the master, so I do a lot of switching in my seat. I'm the client, they're the therapist, and I start asking them, what do I do if this happens? Even kids who are really not wanting to approach their anxiety are able to tell me if I'm afraid of something, I can do it, and that's what I have to do to be not afraid of it, and I can break it down to make it easier. So when I flip it around, that resistance is not there anymore because they're just telling me what to do. And then when it comes out, then it's clear to them, oh, I guess that makes sense. Playing games, books, the older kids, any kind of like YouTube clips, apps, TV shows, movies, kind of media, using that to your advantage, you know, finding things that work for them. So those are sort of some of the processes you can use. And there's every book, all the children's books, almost all of them are somebody overcoming some kind of adversity. And normally the way they do it is they face it, they cope with it, and they get through it, and then everything feels better. And so that's a really kind of nice thing to weave into a classroom if you're talking about a book that the kids have read. You know, preschools, a lot of times they put things on the wall, problem-solving wheels, how to calm down when you're upset. Having something on the wall in a preschool about what do you do if something makes you nervous, but it's not really dangerous. That might be a thing to add on to the wall. The other piece in this process is the support team, and at the end I'll talk more about how to help you support the child you're trying to support. So with the thought piece, the cognitions, and I've divided by younger and older, but just thinking about a way to explain how their thoughts influence our emotions is the point here, as well as thinking about a way to know that sometimes because you have a thought, it doesn't actually mean it's correct or true. So with young kids, I often use red or green thoughts because red makes you stop and green lets you go. Thinking about, is that thought a trick or the truth, right? Is this one little part of tricking you in your brain? Because think of the rest of your brain and all the logic you have in there. Like, what's really the truth, and is this a little trick? How likely is it that this terrible thing they're thinking is going to happen? Good concrete examples. How many days old are you? How many days has somebody broken into your house? And usually it's like 0 over 4,054. And they like that. That's interesting to them, that, wow, it really hasn't happened even though I've worried about it all the time. Thinking about the immediate effects for the younger kids, they're not getting the bigger picture. So what they're probably getting is, it's making my small problem bigger. When I react to this and people are trying to get me to do it, it causes conflict, people are getting mad, there's lots of yelling between family members, whatever it is, they're thinking about that sort of immediate picture. And the idea of externalizing anxiety and using metaphor, those are very valuable ways to reach a kid. And again, the externalization helps a kid see, okay, just because I think this doesn't make it real. And so that it's a really good way to get some distance from it for them. The older kids, you're going to go more direct. What are your anxious thoughts? What are your alternative thoughts? They can generate those. The younger kids, often you have to kind of insert the green thoughts. They might not be able to generate them, but some can. But the older kids, they can generate them. The questions when they have this automatic thought, is it accurate? Is it helpful? If no, let's do alternate thoughts. Probability overestimation. So yes, a meteor could come through that window right now and kill me, but is it likely? No. My anxiety makes it feel like it is, but it's not. Big picture. The kids who are older get it. They get that they're now doing poorly in classes because their anxiety is getting in the way. They get that their friend circle is shrinking because they haven't gone to social events because the anxiety is getting in the way. They get that their day is taken up by rituals, 4 hours a day, because they feel like they have to do it because of the anxiety. So they can see that big picture. They can see what anxiety is taking away from them. And then for the support adults, validating how it feels. So even if it seems silly, like really, that's what's bothering you, to them it is very real. It feels really real. And unless you can meet them there and let them know you get that, it's a fight. Because to them, it feels like you just ask them to go to the top of the highest building and jump off without looking and trust that there's a trampoline there. Like that level of fear is what they feel, even when it's a thought that doesn't make any sense. So validating that. And with OCD, just a caution here is a little bit, sometimes you have to watch with the cognitive work with obsessive compulsive disorders because the cognitions then turn into rituals. So things they have to think in order to make their anxiety go away. So it's just, you can do some cognitive work with OCD, but you do want to take caution to make sure it's not switching over into a ritual. Here's just a picture of externalizing anxiety. This is a little girl that wrote a story. So every time she came into the office, we'd write a story about the anxiety. And you can see in the highlighted part, it says she named her worry thoughts the goblin because these thoughts made her feel scared all of the time. The goblin thoughts told her too. So again, it's taking this thought, it's externalizing it a little bit, so she can get some distance and saying, okay, just because the thoughts are thinking that, you don't need to do it. Caveat with the younger kids, sometimes they do get confused, like is there a goblin in their head? Or so I usually really make sure they get that. If they don't get it, I make it more clear for them in some way, or externalize in a different way. But this is a really nice way for kids to kind of put it outside themselves and think about what they're thinking and what they're doing. So the emotional and the physiological arousal part, the key to this part is acceptance of the negative feelings and the automatic thoughts. You can't really control those just come. Some kids just see the bad parts more often. Some kids just think about the bad parts more often, and they get anxious easier, and it just happens. But it's okay. People who are avoiding are pushing away. They don't want to feel the bad things. They don't want to feel anxious. So accepting it and saying it's okay to feel anxious is a big part of what they need to move forward. The idea of ignoring your thoughts and bossing them back. I don't need to listen to this. I don't need to run away because my anxiety tells me to. Really, the take-home point for a lot of kids is getting them to flip the idea that feeling anxious is, instead of the anxiety being the problem, that feeling anxious is not a problem, but the inability to sit with it is what causes the problems. It's what steals your opportunities, because now you can't do the thing that you really want to do because you're anxious. And again, with the physiological, sometimes just giving the kids the information, your body's just working, really helps them be able to not react to those physiological sensations that can be very disturbing for some kids. So here's one creative way to learn about cognitions and feelings. So on the right-hand side, you just see a page with feelings, and the child just marked off what they felt. So this is a child whose grandfather had died by suicide. And he did not want to talk about it. He was young, he was 8. And so the first thing I did was I handed him the feeling sheet and said, mark off how you felt and when you think about your puppy, and he did. The second side, we used color. So identify what colors are what feelings to you, and color in your body. On the left-hand side, that was the first session. On your left-hand side, color in the body the way you feel. At that point, there's no talking. He's just coloring. And with a young kid, sometimes that's a better way to get at what's going on. And then afterwards, I asked, well, tell me why is your torso green? Why is it guilty? And he said, well, I thought he died because of me. So he knew something terrible happened, but he didn't know exactly what happened. He just knew his grandfather's heart stopped. And he, in his mind, thought he always made his puppy happy. So maybe his heart stopped because he just talked to him on the phone and he was really happy. So, you know, those are some of the things that I don't know that I would have gotten at just talking to that child. And you can see on the after picture at the end of therapy that he's mostly happy, and he has some little pieces of still sadness and guilt and confusion, which is good. That's still okay. It was a recent event, and he just got new information about it. So the behavior, this piece is the most important thing. The reason you're even worried about the thoughts and the feelings is because you want the kids to be able to use those pieces to do the thing they're afraid of, to be exposed to the activity or whatever it is that's making them scared. If you are the support adult, an important thing is, I hear a lot of parents say, but I want my child to know I got their back. I want them to feel like I'm protecting them, which is fantastic if you don't have a clinical level of anxiety. But when it flips to a clinical level, if you have your child's back by sort of accommodating them, by helping them do all of those pieces to keep them away from what they fear, their world starts to shrink. They start to have less of a life. And it's better to actually help them by joining them where they are and kind of nudging them forward. How can we do this? How can I help you do this thing that's scary? Building on their success and interest, big. What do they like? What are they good at? How can you weave that in? How can you help them be successful when they approach something they're afraid of? Keeping an eye on the larger picture. So what are they going to get back from this? And the idea of making it a group effort. So everybody is scared sometimes. Everybody's anxious sometimes. And I love this quote by Eleanor Roosevelt, do one thing that scares you every day. This can be a family thing. At dinner, you can talk about what did you do that scared you every day. In the classroom, it can be something. If there's a book about facing your fears and the classroom contribute, well, what did you do? What fear did you have that you faced? And how did it turn out for you? That's a good sort of group discussion to have. And so it's not all falling on the one child. And again, it kind of normalizes it a little bit. That fear does get in the way for a lot of people. Another way to help a kid think about and talk about anxiety is to help them break it down. So think about the hierarchy from 0 being no problem, 5 being pretty anxious or somewhat anxious, and 10 being the most anxious you can ever think of. So, and then think about how to break down the fear. So what would be a 3? What would be a 5? What would be a 7? How can you break that down? Because when you start approaching, you don't want to start approaching at a 10. So you want to help them be successful. So that's another way to help them think about it. When you're doing exposure practices, it is different for older kids in certain ways. With the younger kids, you're more directive. You're using more age-appropriate language. You're not using so much the adult terms, but you're using words that they can understand and relate to about this. The emphasis tends to be more on behavior. Lots of these kids can't give you the cognitions. They just don't like it. It doesn't feel right. It's icky. That's fine. Emphasis might be on behavior. Because of that, there's often more goal setting and external rewards. So it's going to be much harder to do something you fear if you're not seeing that big picture. And if you don't even know what's behind it, to help yourself with the thoughts and the feelings. So having that external reward in order to approach a scary exposure or a scary situation is important. The exposure should be fun, but not too distracting. So sometimes kind of mixing it up a little bit. You know, this is a funny example, but there was a girl that was so afraid she would get salmonella from chicken that she couldn't even be in the same room as chicken. So she couldn't be in the lunchroom. She couldn't be anywhere there might be chicken. So one of the things we did was we brought in an uncooked chicken breast, and we played a game of catch with it. Now we went and we washed our hands because we talk about the difference between real alarms and false alarms. So if I go now with this raw chicken and I don't wash my hands and I eat something, that's a real alarm. I could get sick. So I'm going to go wash my hands. But it's okay that I touched that raw chicken. That raw chicken can't hurt me. I washed my hands. So, or even just being in the room with it. We didn't even have to have a catch, but that was the point we were at in kind of our approach. And then positive pairing. So sometimes with the kids, it's a matter of just putting something pleasant in place. Every time it thunders, we have ice cream sundaes. Whatever it is, some kind of positive association with the scary situation. With the older kids, they can be more independent. There can be more realistic discussion of risk and values. You can talk more about both the thoughts and the behavior. They see the big picture rewards. I'm going to get back to school. I'm going to do better in school. I'm going to have more friends, whatever it might be. I'm going to have 4 more hours in my day that I don't do rituals. They don't need to be so fun. They can be more head-on. And you want to stack the deck in their favor. So just thinking about what they'll succeed at and helping them approach that way. Breathing and progressive muscle relaxation can help someone pause and stay in the moment. So you don't want them to breathe as an indication that this is something to be feared, this is dangerous. But you do want them to be able to regulate their breath to help calm them a little bit so they can stay in the situation they're afraid of. Across kids, these are very important aspects of what you want in an exposure. They should be voluntary. No one should be dragging a kid to do something they're not ready to do for an exposure. If you're dragging them, it means it's too hard. Go down the hierarchy. Find something easier. It should be collaborative. They should be part of the plan. They should feel in control. Part of being anxious is feeling out of control. So at least they should be in control to help collaborate on the plan and what they're going to do. The idea is manage anxiety and not avoid it. Anxiety is not bad. If you're feeling it, it's good. That means you're doing what you should be doing right now. Hierarchy driven, and you want to build on the accomplishments and not dwell on the failures. So you have an exposure and it fails terribly. It's fine. It was too hard. What else can we do? Let's break it down some more. Were you thinking something you didn't realize you were thinking before? So you use it to help inform your next step. Here's an example of a creative writing exposure for a girl that was afraid of her school mascot. So at first, even looking at a picture of it was too hard for her. But she was willing to write a little poem. She had a book about fear that had this poem, and she kind of just superimposed her fears. So she put in there about the cougar looking big and mean, and that he had scary teeth and evil eyes, and she was afraid he would eat her, but that she didn't run away. She looked him in the eyes. She said, "You can't eat me, you can't scare me, you're nothing but a person inside a costume." Writing this was very difficult for her. She didn't even want to talk about that cougar. But she couldn't attend any school events because the cougar might be there. So this is where we started with her. Bumping it up at the end, her mom got it was summer, and her mom got the cougar outfit for us, and we were able to play Mother May I in the hallway. And she gradually, that's me, dressed as the cougar, and she gradually worked her way closer and closer to me, and eventually put the head on herself. And from that day on, which was really just one day of this intense exposure, she was able to go to school events. So how to motivate kids? This is hard to do. You're asking them to do something that's scary for them. So the first thing is to tap into interests. Help them understand this whole process by using their interest. Since I happen to have 2 boys and happen to read the Spider-Man encyclopedia a lot, this is an interest that I've used with many of the kids that I've started working with that also are interested in Spider-Man. So the idea of this alien symbiote costume that falls on Spider-Man and gradually takes him completely over. And at first it feels good, it feels powerful, just like avoiding feels good at first. But then if you see in the second picture, it takes over to the point where Spider-Man doesn't even feel like Spider-Man anymore. His life has changed, it's awful, it's taken over. And then the last scene is Spider-Man ripping off the costume, ripping off the alien symbiote. And so kids can kind of look at that and say, okay, I get it. Yeah, it did sort of take over little by little. And now I am feeling like my world has gotten smaller. And I really want to rip this off. Like, how do I do it? What do I do? Okay, well then let's do an exposure. Let's approach. What can you do? Let's break it down and figure it out. The other thing is, what's anxiety taking away from them? So again, with the little kids, this is less clear for them. But with the older, and some little kids it's clear, but some not so much. But the older kids can get this. When you're stuck, I don't know if you know the story of the Zacks, but there's a north-going Zacks and a south-going Zacks, and they come head-to-head, and neither of them will budge. And they end up standing there and staying there and not moving. There's no flexibility. And around them, the whole world keeps going on. And that's what anxiety does. You get stuck. You stop. You can't budge. You can't be flexible. You can't move one way or another because you're too anxious. But the world does keep going. So what's it taking away from you? Is it taking away getting back on that horse that you fell off on once, that you really love, that you want to get back on? Is it taking away school events? Is it taking away your time? What is it that you're losing out on because of listening to this anxiety? So some self-talk that they can engage in, some questions. They can start to think, what am I going to take back when I face my fear? What am I going to get out of this? You know, and again, here's where the external reinforcement comes for the little kids. What they may get out of it is a Pokemon card or something, because they're not getting that big picture again. The older kids can think of the big picture. What can they think to help them face their fear? What can I do to help me face my fear? What can my team do to help me? What can my parents do? Is it helpful if they say, okay, you don't ever need to go out of the house for anything, I'll just bring you all the meals in your bedroom? Or not. And most kids can say, well, no, that's not really helping me. I like it because it lets me avoid everything, but it's not helping me. And what will happen to my anxiety? It will not last forever. So some of the answers to these questions that kids can talk to themselves are, like, I'm willing to tolerate the discomfort because X is important to me. Is this a false alarm? Going through those cognitive things. What else can I think? The idea, getting that idea that if I avoid it, my fear stays. If I do it, my fear weakens. Again, that really big idea that anxiety can't last forever, that's a good one for kids to get and to think to themselves. That they have the support of people who are around them. That even though anxiety is there and those anxious thoughts are there, they can leave them chatter in the background, kind of like an annoying, you know, somebody in your class that annoys you, and you don't need to pay attention to them. You can still do your task at hand. You just let them chatter in the background so they can think about doing that. They can also think about using their frustration to motivate them to approach. So often kids will say to me, well, I got into a fight with my dad because I was talking to him about what I was anxious about and I didn't like any of his ideas and I was really mad. And I usually suggest, you know what, use that anger, but not against your dad. Use it against these thoughts and feelings that make you think that you can't do the thing you want to do. Get frustrated enough that you say, forget it, I'm doing it. And use that to motivate you. So kids can often use that frustration to help themselves approach. Here's an example of self-talk, same girl that wrote the story in the beginning. The story was continuous. But if you can see in here, this was further into the therapy, the highlighted parts, she says when she heard a noise and she was scared, she started to get used to it. So she's getting it. If she stays, she gets used to it. In response to the thought to leave, it was no way. I don't want to miss out on the rides. I stayed. So what's she going to get? What opportunity is she giving up if she leaves? And what's she going to get by staying? The goblin thought got so weak and it shrunk. So she took all the power away. She can give that thought power or not. And when you don't, it gets weak and it shrinks. And then soon, she didn't even notice the noise anymore. She just had fun. What's that positive outcome for her? And what would it have looked like if she left? A whole different story. So that's one way you can help the kids weave their self-talk into something creative. Same girl, another way is just bullet points. So this was at the very end of therapy. We just did a summary, and she wrote what she realized. And again, these are the same concepts we're going over, so I'm not going to run through it, but it's just a different depiction of how you can help with the self-talk and get them to kind of make it their own. Rewards we have talked about quite a bit. Again, the goal is to enhance motivation. Or if there's other problems that get in the way, like ADHD, you might need to work on some of the attention and impulse control in order to be able to even get to the exposure. So it can be used for those other problems too. You've got internal and external rewards. Again, the older kids tend to sometimes just do, usually they're fine with just the internal. They have something that they want to gain for themselves. Younger kids often need an external reward. You want to select a reward. It can be concrete, immediate. It can be social sometimes leading up to concrete. So if you do it right 7 times, or if you approach it 7 times, then you get this, whatever it is that's concrete. You want to reward effort, not results. The child really tries and they bail out. You know what? They tried. And they didn't not succeed because they didn't succeed because it was too hard. So go back, redefine what you're doing, but they still get the reward for trying. You want to clearly define what they're going to try. And as far as how often, you just want to think about, you know, for younger kids, they need more frequent rewards. For older kids, you can wait longer. So this last part about a support team is important. Often when kids come into the house, into my office, there's lots of conflict. So, and usually it's divided as the first set of circles on the top. So the child is sort of aligned with their anxiety and their avoidance, and the family and school are on the other side. So everyone is saying to this kid, come on, just do it. What's the big deal? You got to do it. And then there's lots of arguing, there's lots of fighting, and the kid is holding on to that avoidance for dear life, and no, I can't do it, I'm not going to do it. The second set that you see that sometimes occurs is with the child and the anxiety and the avoidance allied on, and the family allied on one side and the school on the other side. Ultimately, if everybody steps back, the picture is that everybody wants to help this child. Everybody wants the child to become more independent, to face their fears. But the process by which it's done can be difficult because a family, the tendency is to protect. Yeah, it's sort of it is your job as a parent to protect your child from distress. So sometimes the family kind of joins with the child and creates so many accommodations that the child's not able to face situations. And sometimes the anxiety is so high that even if the parent tried to get the child to do it on their own, it may be very difficult to do, and or it may not work, which is why then you have options like therapy and medication and other things that are out there. And the school piece on this side, often then there's a lot of conflict between the school personnel and the family. So at that point, the best thing to do is kind of realign and rethink this and put everybody on one side. The support team should involve the child, the family, and the school. And everybody should be allied to figure out how to manage this anxiety and stop avoiding. And once you put it outside like that, instead of a parent saying, you need to do this, why can't you do this, I'm going to drag you in instead, if you can't do this, I'm just going to drag you in. Instead of that interaction happening, then a parent can say, did you catch that? That's the anxiety, it's getting in the way, that's infuriating. Like, I know it feels really bad, and now you're missing your opportunity to be at this social event. Like, what can we do? What can we do with it? And that feels much better. It feels more like a team. And so everybody working together in that way is helpful. This is like an amazing depiction of that example. So this child was 11, and he was anxious about being lazy and being unhealthy, but took it to very rigid extremes. So he was very underweight, significantly underweight. He was up and moving, I would say, most of his waking day. He stood in the lobby. If he had to sit in a chair, he would hold himself up by his arms. And much anxiety about just he didn't want to be lazy and he didn't want to be unhealthy. Again, self-fulfilling prophecy. If you have too much anxiety about that, you actually become less healthy. So we discussed that a lot. And so here, this depiction, the reason I like this is because, so he named his anxiety the food later and made a really angry hamburger bun, and that's in the center. Over the right-hand side, he had all the things that come with that. Anxiety, conflict, teasing, depression, and then all the things that he actually doesn't want to happen, like muscle strain, potential osteoporosis later, bone loss, anemia. But because he's not eating, he's actually making himself more unhealthy. So it's that, again, that self-fulfilling prophecy. But what I love the most about this is on the other side, he has his support team. And he did this all himself. And he put his brother, himself, his mom and dad with their superhero capes up in the corner all together. And then he put me as this little person peeking in the side. And the reason I like this is because the work the kids have to do to get better and to face their fears can't all be done in the office. 1 hour a week doesn't do it. And so he really saw me as this sort of little person on the side that was guiding, and he had this big support team. Now, his school was not involved here because they didn't need to be. At this point, it wasn't actually affecting anything in school, so it was just his team, you know, that was involved in my office. But if a school was involved, it would be good for them to be on there too. And again, here's him approaching anxiety. Here's him going up and saying, you can't, I'm not listening to this. I'm done being anxious. I mean, I'm done listening to this anxiety and being underweight and maybe potentially hurting myself and getting teased and feeling depressed. And again, I like how he and his family, he's in the middle, he's the central character, he's in charge. His family's off to the side, but they're all together. And again, I'm over on this other left side, helping out, part of the team, but kind of less essential, which is important. So some things what not to do. So, and these things we've run through already, but excessive accommodation, making sure, excessive reassurance, helping them avoid anything that you do to kind of says, okay, it's okay, you're anxious, you don't need to do that. At the same time, you don't want to do a surprise or forced intervention. You don't want to throw them into the deep end of the water if they can't swim. You want to always think hierarchy. You don't want to punish the anxiety. Now, some kids have behavior that comes with anxiety, and that might be punished. So if a kid is actually throwing a tantrum and destroying property and hitting people, you would be giving a consequence for that behavior. But if they're anxious and they'll go somewhere, you don't want to punish them for that. Being the anxiety police, everything becomes anxiety. That's another big thing. You forget who your kid is. You forget what their strengths are. And so it's really important to kind of remember those. The other piece is just inconsistency, discord, and lack of communication within the support system. So what to do is, and this again, we've already run through these, so real quickly is team effort. Join your kid where they are. Stay positive. Did you catch that? What's it taken away from you? Think about what's supportive. Sometimes the verbal part for teens is not so supportive. Sometimes hearing their parents say, oh, what do you think? Is that anxiety? Not so supportive. Sometimes it's better to have a nonverbal signal. Sometimes it's better for a parent to kind of distance a little bit, enjoy their child for everything else they are, and let the therapist or the teacher that's working with them work with them on the anxiety and just enjoy them for everything else. Doing planned exposures is important. An unplanned exposure, you can't control any of the factors. You can't do a hierarchy. But if you practice, you plan and you practice, and you do the exposures over and over, they will get better. Model. So model you're handling their distress as well as you handling your own distress, and you approaching things and doing it together as like a group project. Thinking like a hostage negotiator. So by this what I mean is when kids are anxious, they go up quick. You want to think, if somebody's in a hostage situation and they're talking to the person who's holding people hostage, the negotiator polarizes. So when that person starts to go up, the negotiator goes down. They talk quieter, they have more pauses, they might get smaller depending on where they are. You know, whatever you can do to kind of polarize and keep a calm and not spiral up with the child. Reducing the criticism and helping them problem solve. Reduce the accommodation and tolerating their distress. And lastly, helping them own their success. I tell every kid in this office, I did not do this, you did this. I wasn't with you for most of the hours of one day and none of the hours for the other day. So here's a nice example of that. I wish I covered the face for confidentiality, but the face on this is gorgeous. This is a little 5-year-old who had OCD, so proud. And all of those things around her are things that she had rituals around, that she did over and over and over. And all of those things around her are things that she was able to stop doing the rituals around. And she got back all these things that used to bother her. And this last slide has her picture. Again, you know, when we externalize anxiety, the kids often draw it. So you've got the big OCD in the beginning and control, and then at the end she has the little dot of OCD. She says the OCD is in the O. That's how small it is. And so, and her feeling very proud that she was able to shrink and manage this anxiety until she basically didn't even feel it. So that would be it. This slide just has information on our place down at Penn and ways to contact us. I also did want to thank again the New Jersey Center for Tourette Syndrome for providing this webinar series. And I'm going to stop for questions, but I want to get to this one resource slide, and you can access these on the internet because they will be on here, so there'll be resources here, but I know there are a lot of teachers. This computer-assisted program was made specifically for school counselors, and it's fantastic and it's empirically validated, and it's not too expensive. So just as a nice resource that's on there, as well as a bunch of other resources.
Wow, thank you. A lot of great information, and we have a lot of questions.
Okay.
So are you ready?
I'm ready.
Okay. First one has to do with parents and the kind of anxiety pattern that they might set themselves up with as it relates to their child. So can parents set up an anxiety pattern in their child by their own actions or behaviors? And if so, how would you talk about that and what a parent should do to get out of that pattern?
Okay, and that's a great question, and absolutely, that's why within this presentation I talked a lot about modeling. So especially, we have anxiety has a very genetic component. So many kids with anxiety disorders have parents who have anxiety disorders or tendencies. So it doesn't even need to be all the way to the clinical piece. So for the parent to understand the cycle and for the parent to also be able to approach, a lot of times it's amazing, I'll have kids and parents work on it together, and the kids help the parents and the parents help the kids. And the purpose of the kids helping the parents is not for them to be responsible for their parents, but it actually is quite empowering to them. If they can help their parent through a situation and then can give them strategies, then they can use them themselves. So absolutely the model is there. Kids are watching what you do more than hearing what you say. So anytime you can join with them and be honest with them about your own anxiety and show them you facing your fears, even though you're anxious, that's a good thing to help start changing that pattern.
So that could be hard for some parents then. The tendency, I think, for a parent is to kind of like hide that sort of thing. You know, I don't want my kid to see this because, right. So they tend not to be as open possibly about that with their child.
Right, and I feel like so many kids put stigma attached to a mental health disorder. And so the more they can know that other people have anxiety like they do, the better. They like knowing about what the prevalence of anxiety is. They like knowing that there's somebody who kind of is like them and feels like them, but also knowing that this person is doing something to help themselves.
Okay. It's a great segue into another question about utilizing family therapy to help a child handle anxiety. So basically, based on your previous answer, that would be a good thing.
Yeah. It really depends. Some kids come in, and a lot of kids you don't necessarily need a huge family approach, especially for some of the older kids. And in fact, with some of the teens, we actually let the parents, we say, you know what, enjoy them for everything else, we're going to work on this. We'll let you know how it goes. And sometimes that's really helpful to kind of just separate it out and just work on it, because the crux of it is doing the thing that scares you and getting used to it and seeing what you take back. And you don't necessarily need a family therapy model for that. However, there are clear times when the family dynamics make it difficult to engage in that kind of therapy. There are clear times when a parent's anxiety is so strong they can't possibly help the child with their anxiety because they're too anxious watching them, and it's not going to work. There are times when the parents disagree on how to handle it, and the conflict between them about how to handle it is greater than we could kind of manage when we do this more specific therapy. So absolutely there are times that family therapy in the traditional manner helps. I also think with the young kids, we tend to do what we call family therapy, but it's really not family therapy. It's more the model we do with anxiety, but it's the parents are in the room. And the idea is the parents are part of the team and they're part of the support. So you're not necessarily going really deep into the dynamics of anything unless there seems to be an issue that you really want to explore, but they're really there to learn what to do so they can continue to help their child through what their child's going to go through.
I understand. Okay. This is a little specific, but I suspect that it's probably not that uncommon. This individual is asking for some suggestions how to help a 13-year-old with a needlephobia. And the point is, it's not like you're going to expose her to shots repeatedly because to get her used to it. So any suggestion on that issue?
Yeah, I mean, specific phobias like that, especially ones that do involve clear pain. We do a lot of needlephobia work here, and sometimes it's pretty extensive. The kids can't walk into the doctor office. They can't look at a needle. They can't hold a needle. They can't put the needle in a puppet. So starting there, starting to get comfortable so that anxiety can go down around the needle, so that they can have one right up to their arm, not pushed in, but touching their arm enough that they can feel it and be able to habituate and not be anxious about it. And then teaching them coping skills for when it does happen. So, okay, so now you're not so anxious, you can't even be around it, but what can you do? What kind of pain management things can you do? What will work? And we're lucky we have a nurse on staff, a psychiatric nurse, so she'll do a lot of the needlephobia work, and she'll let kids give her shots. So she does a lot of things like that, and then teaching them coping skills and having them finally go to the step of getting the shot.
Okay, so it sounds like you need a professional to kind of work you through that whole needle thing, probably.
If it's the point where the child is not getting the medical treatment that they need, absolutely.
Yeah. I actually have a question about Tourette, and specifically about reducing stress and anxiety in students with Tourette. So this came from a teacher, and we'd like to have you talk about that a little bit.
Sure. So one of the triggers sometimes for tics is anxiety. So being able to find ways to kind of decrease that anxiety helps, because it helps trigger less tics. That's not always the trigger. Sometimes it's boredom. Like there's lots of different triggers, but that's one of them. And so figuring out, again, going back to kind of that central model, what thoughts are they having that's making school hard for them? What feelings are coming up with them? What are they doing that might be maintaining that anxiety for them? And kind of then going from there, doing that detective work first, and then figuring out how to kind of help them use that to decrease their stress by figuring out how to manage it versus just avoiding it. On the other side, really basic things, and this is for all kids who are anxious. Are they getting enough sleep? Are they eating? Are they eating well? Are they eating the meals they need to eat all day? Are they moving enough? Are they getting out? What does their friend system look like? So looking at this very basic living things also really affects a lot of kids' anxiety, and you can kind of head it off in that preventative way sometimes also.
We had a question that had to do with a partnership between parents and teachers to help a child with anxiety, but that is seems to me, kind of part of that same thing that needs to happen. Are they getting enough sleep, and are they eating well, so that the parent and the teacher really need to collaborate on that.
Yeah, and it's tough. It's hard because, time is limited for everybody, and teachers who have 27, 28 kids in their class and multiple classes that they're teaching, it's very difficult to find the time. But having those, if a teacher can somehow fit that time in there to collaborate with the parent, to kind of look at key things to see if they're in place, to think about how to help the child together. A lot of those kids might have 504 plans or IEPs, and in which case you do have some meetings to be able to process some of that information. But being really creative in ways that you can fit that collaboration into your day and fit it into the school schedule somehow, it really helps to have that support piece. And often, if you can just have one point person in the school, and often it's the counselor, the school counselor, that point person, the school counselor has more time than the teacher to have those discussions with the child and the family. And then that person can be the point person for the other teachers. So whatever they collaborate on then can go out to the other teachers, and the teachers can make it fit into their classroom. And then feedback can go back to the school counselor and back to the family.
Okay. If you have a child who has what might be called moderate anxiety, how can you help them, like now, before it really gets something that's out of control?
That's a good question too. All good. Yeah, I mean, I think that again, the reason I ran over the principles in the beginning, which can be a lot drier than kind of going over the techniques and how to do them and the strategies, is because that really is the foundation of how you want to think about anxiety. With kids with moderate anxiety, just kind of working those concepts into their day, that if you stay away from something you're afraid of, it can get worse. If you do the thing you're afraid of, you'll get used to it. And you working on that modeling, working on doing it together with them, ways that kind of can head it off so it doesn't go in that direction where it goes down the path where it gets more severe. And just kind of making it a part of your daily conversation. It's just kind of the way that you talk to your kids about what's going on. And it doesn't need to be, it can be something structured. I mean, in my house we have a tree on the wall, and the tree has various functions. So at times, on Thanksgiving or November, it's always the thankful tree. So every night at dinner, the kids mention what they're thankful for. We put it up there. Sometimes it's the kind tree. And every night at dinner, they tell me some kind things they did, and we put it up there. Sometimes it's the brave tree. And they say what they were brave about that week, and we put it up there. And we try to fill the tree as much as possible, and we work as a family to fill the tree. And when we fill the tree, we have a family game night or something fun. So it's sort of this, it's just part of our lives. It's part of how we think about who we are and what we do.
Oh, I like that. You know, I think it happens too in a busy family, for example. You can have a kid with some moderate anxiety, but it's lost in the shuffle too of just the routine that goes on in the family, and you don't spot it right away either.
Right. And I think, you know, again, working it into at reasonable times. If you have a younger kid and you're giving them a bath, do some storytelling, and the storytelling can be about anxiety, and they can process it that way with you. If you're driving a kid to events, you've got that time in the car. Mm-hmm. If your kid doesn't like to sit and talk, go shoot a basketball with them. And every time you're shooting basketballs, kind of little things come up, but even just kind of talk about something that happened in your day that you were afraid of and what you did, so that you can kind of have those moments of connection within your busy life.
All right. Have a question. Another question that has to do with TS. Would you discuss how to talk a child down from a high anxiety state that causes some significant TS symptoms?
Sure. So, right, when kids are really in a high state, approaching is not going to work. Doing the thing they're afraid of is not going to work. At that point, they're floundering. Their emotion has taken over their logic. In that moment, talking them down is the best thing to do. So, you know, I liken it to, and I don't know where I heard this, somebody said it once, but I thought it was great, is if your kid was in the water and they were drowning, you wouldn't start to teach them how to swim. You would throw them a life preserver. You would take them out, and later you would have swim lessons, and they would learn how to swim. And so that talking down, again, is that idea of the hostage negotiator. And if you ever watch a movie, it's sort of fascinating to see that polarization. So getting quieter, giving the child a little bit of space, telling them at that moment, you know what, this is really hard for you, I get it. We're not doing this right now. Okay. Going ahead and helping them to come down, because pushing them to do that, whatever they need to do in that moment, is probably not going to work. But always keep in your mind, if you wait for that moment again, it's not going to work again. You have to kind of put the effort in between to practice doing the things that are hard to do. And for a lot of parents, again, who are busy, that's hard.
It's like rocking the boat, kind of. You don't want to bring up the thing that's really hard to do, because it could create a situation.
Right, and many parents, when their kids are handling something, well, they on purpose don't say anything about it, because they're afraid if they say something, the kid will then become anxious. But it's actually better, and if you don't want to say something in the moment, it's then later. I noticed today you did this. Like, you were able to say, okay, I'm not letting that thought or that bad feeling push me around. I'm doing it anyway because this is what's important to me. And that was really cool, because the kids really need that feedback. And again, the time is an issue. I think parents will say, I don't have time to practice 45 minutes a day with my child. And usually my question to them is, are you arguing with them 45 minutes a day about anxiety? And almost always the answer is yes. So then the question is, are you willing to replace that 45 minutes of arguing with 45 minutes of doing an exposure that will ultimately take away that you'll get all that time back in the end. You're just replacing the unpleasant time with some pleasant time where you're working together.
Wow. I think we have time for one more question. How do you approach a child who is resistant to doing exposures?
So that piece is really, you really have to join them where they are. And this happens, you know, I see it also in the office very much when the child is in the office simply because the parent made them come and they don't want to be here. So just kind of going back to that idea of thinking about what's the anxiety taking away from them. What do you want? What do you want your life to be like? If I waved a magic wand, I got rid of your anxiety, what would you be doing? Well, wouldn't it be great if I don't have a magic wand, but wouldn't it be great if I could help you figure out how to get there? And really kind of joining with them about how awful like this anxiety has made their life, how small it's been, how they're depressed, how they have no friends because they can't do half the things they want to do because they're anxious. And really just getting that with them so that they feel heard, they feel understood, and that they can kind of see what's in it for them as far as doing the exposures. And then again, making them easy enough for them to actually be able to do. So breaking it down. So this is a kind of a funny example, but it really shows how far you can break things down is with obsessive compulsive disorder, with contamination. We often talk about the thing that touches the thing that touches the thing, right? So the kids can't touch the doorknob and not wash their hand. But if I take a Post-it note and touch it to the doorknob and then touch that to the desk and then take a pen and touch that spot on the desk and then have the kid touch the pen, often they can do that. So breaking it down, getting them, joining them, letting them know you get it and you heard it. Then breaking it down and helping them go forward. If that still doesn't work, then if it's a teenager, a lot of times backing out and letting somebody else do it with them, letting a therapist do it with them. Because at that point you've got all the developmental pieces of rebelling anyway coming in. So sometimes just that parent-child relationship is hard. Maybe there's a teacher at school they have a good relationship with they can try it with, or if there's a therapist they can try it with. And then even with those pieces, sometimes the anxiety for kids is so high that they can't do this treatment. And then you have a choice. You can go to family therapy or some kind of supportive treatment until they're ready, just to deal with the conflict that comes up around it, because there is a lot of conflict, so that that doesn't get out of control. Or a lot of parents will then go to medication, have their child take medication, come back and do the treatment, and then wean the medication, because the medication takes enough of an edge off the anxiety that now they're able to do the exposures.
I know I said one more question, but I have one more.
Sure.
That was the last one, but I have one more.
Okay.
Can we just talk about, like, what's the age? I mean, what's a good age for kids to begin to look at this? Then, I mean, we talked about teenagers and things that parents need to do with kids when they're giving them their bath. But where are we in an age range?
I would go less by age and more by the questions about development, intensity, frequency, and interference. Because any age, I mean, I've worked with kids as young as 2 and 3, some with sort of a more typical develop, and some kids with autism that have very little language but have very specific fears that are interrupting their lives. And people as old as, 75, like it can kind of go across. So you can really do it at any age. You just have to tailor how you describe things and how you help them be able to approach. The bigger question is, when does it kind of cross over to the point where you feel like you need to go get some outside help for it? And, and that often is that sort of frequency and intensity and distress. And if you don't need to cross over, is it disrupting their life enough that you can do something in the house? Is it moderate enough that you can kind of on your own try to see how you can help them?
Yeah. All right, Dr. McGovern, thank you very much. Really enjoyed your presentation, and I think we got some good questions answered as well. So thank you.
Thank you.
Thank you all for joining our webinar on Nothing to Talk About But Fear Itself, How to Interact with Children About Anxiety. There is an exit survey which we need everyone attending to fill out. The discussion board is open now and available for the next 7 days on the NJCTS website for any additional questions that were not covered in tonight's presentation. That website is www.njcts.org. cts.org. Also, an archived recording of tonight's webinar will be posted to the site. Our next presentation, Beyond the Incident, Preventing Bullying, will be presented by Dr. Stuart Green and is scheduled for November 16th, 2011. We hope to see you all there. This ends tonight's webinar. Thank you, Dr. McGovern, for your presentation, and thank you, everyone, for attending. Good night.